I'm really worried about the kind of unintended consequences of this that, of course, in wanting to protect healthcare workers, we're also creating a whole reality of people having traumatic birth experiences. On March 18th, New York Presbyterian Hospital System and Mount Sinai Hospital System updated their visitor policy to bar any laboring person to have either a partner or a family member or a trained professional like a doula. So they're having to labor completely alone. I think that partners are having a really hard time because they want to be there for the birth of their child, and they also want to be there to support their partner emotionally however they can. There's tons of peer-based reviews that show that having continuous support in labor, either from a partner, but really also from a trained professional like a doula, reduces unnecessary complications like C-sections, longer labors, interventions. It increases chances of a vaginal delivery, of having a more positive experience of your birth, of having higher rates of breastfeeding. And we know that all these things ultimately benefit the health of the laboring person and the baby. It's clear that low-income women are a much more vulnerable population when it comes to negative outcomes with pregnancy and birth. Women of color, low-income women, and immigrant women face particular challenges when giving birth. For example, someone who doesn't speak English might really have a hard time understanding what's happening clinically, might have a hard time communicating to the nursing staff and to their OBs what they need, what they're feeling, if they're worried about something. And that's why it's so important to have somebody in the room, whether it's a partner or a doula, to be able to communicate on behalf of the person if they're having a hard time. Birth is an opportunity to have a really positive experience. Creating a situation in which people are not going to be able to have any support really raises the possibility of having a traumatic experience. Rates of postpartum depression can go up. People can have, nightmares about their experience that really are going to affect how they're parenting in those first few weeks. it makes sense that this policy was enacted as a result of the concern that healthcare workers have over not having the adequate equipment to take care of themselves. And so I like deeply sympathize with that. And I'm not in any way criticizing their concern. But the long-term concern over this is that other hospitals follow suit. You're going to increase the chances of even more unintended consequences because more people are going to have to be laboring by themselves.